So Dr. Kunal Vashisht is with us today, and he's just going to join in a second. I think he's having some technical difficulty. He's just going to join, and he's going to answer all our queries and questions which have come to us already. And if you have more concerns, questions, you can just keep messaging us on the page, and we'll get back to you individually. We'll send a message to you with your responses. So Dr. Kunal, you're welcome to the session today, and thank you so much for taking time out for all of us this evening. I was just telling everyone that you've been extensively working with the people, with young people, old people, children who've recovered from corona, and you're helping them get back on their feet, on even if it is just breathing right, or the right exercise, and how to actually get back into a rhythm. So Dr. Kunal, over to you.
Yes. Hello, everyone. Namaskar. So my name is Kunal Vashisht, and I'm a physiotherapist who has been in this field from last 14, 15 years. And my aim, or my objective has always been how to make people more physically active, because when people come to me for aches and pains, this is what we do. And if we are not able to kind of, you know, uh, give you little motivation towards how to become more active, and various self-management strategies and all that, nothing works, because you cannot actually put on all the onus to us for getting better. Idea is you should be actually proactively participating in all the recovery processes which we do. Now, sadly, we are into the pandemic right now, and this proactive approach which we have been trying has really helped people, because that's the way to go forwards. Okay, so we do a lot of online sessions with people, and as you know, when there is an online session, you cannot be fully dependent on us. We have to definitely make you proactively involved in the treatment process to recover, and luckily the results are very, very good versus what it used to be before the pandemic. Okay. So what I'm just trying to say through this, my message is that when you actually take your recovery into your own hands, it's actually a total different strategy which you work through, and you get better results and other stuff. Now, since we are already talking about a very serious topic today, which is COVID-19 disease, which we have been struggling to get over with. We are seeing people dying around us, struggling to find beds. Uh, the recovery is very poor, extreme fatigue is there. Okay, so all those things are there. So today we thought that can we just bring out exercises as a major tool to recover out of COVID-19 disease. Now, earlier the COVID-19 used to be okay. We thought that it primarily affect lungs, and you just get better with your lungs and you'll be over with. But slowly, we are trying to understand, this disease is not just limited to the lungs. It's actually affecting a lot of body systems besides lungs, your organs, your muscles, okay, your stamina, your capacity, all that is getting affected. So today we'll be here to discuss, what all things gets impacted through COVID-19, and what all small strategies you can follow to kind of recover from it.
So, Dr. Kunal, my first question would be, like I was just saying earlier as well, like I have had friends who have recovered, and they're finding it difficult to even move about in the house. It's been like over a month of recovery, or even longer in some cases, and they're just finding it very difficult. So in your experience, because I know you're extensively working with people who post recovery and helping them get back to their physical fitness levels which were before they got COVID. Now, what have you seen are the problems, like, in terms of short term or long term, like from your experience?
See, anyone who comes post COVID to us knows that actually the scene is totally different from what it used to be before the COVID. The healing is slower. The recovery is
Okay.
very, very slow. People need to be really cautious of, how do they should be actually restarting their fitness journey back again. And even when people are simply coming with back and neck pains and all those things, it's actually taking them
Yeah.
longer to recover. And it is not just the influence of the infection; it's actually our mind as well. We're into a pandemic. There is a lot of negativity around. See, the body is healing very, very
True.
slow because the mind is also
True.
not happy about things. So
Yeah.
it's actually the collective issues which we are facing due to this pandemic.
So is there any particular age group that you're seeing is getting physically more affected, or it's just across?
I mean, the difference in first wave and second wave is actually, it's actually totally a contrast right now, what we are seeing, right?
Okay.
So
Okay.
elderly are, the first wave, it was primarily affecting the older people. Second wave, it's a lot of younger people getting affected. Okay, I was reading
Yeah.
somewhere where they say, people were asking why the young people are getting affected now. Number
Hmm.
one is they are the ones who are going out of their houses.
True.
Okay. Yes, and the mutations which have happened, and obviously we are not any COVID experts here. We are just exercise
Yeah.
experts who wants to try, how exercise can help COVID recovery. So that's what we're going to talk about today.
So, are you going to take us through how to reapproach exercise and the precautions one has to take?
Yes, exactly. So what happens
Perfect.
is whenever we have to talk about solutions, we should be discussing the problems first. And if you understand the problem, the solution can work better for you. There are studies, which shows that I'm talking about from the exercise perspective. When the
Yeah.
exercises are meaningful to you, you actually follow them more religiously or regularly. So it
Very
is
true.
important that the education has to be around it. You cannot simply just throw, here is an activity, please do it. You may not do it because
Yeah.
you're not finding it meaningful as well. So I'm just coming up with few problems which we face after when we are recovered from the COVID infection, but we are still facing, as you
Yeah.
said, no, people get tired too much and all those things are happening. So let me just throw
True.
light towards various points which can affect our recovery when we are actually out of the infection, but still getting affected. So I would say
Great. Great.
primarily we should be talking about the mental health here because that's the main thing which is happening. See, there is a lockdown, there are bad news around us. We
Yes.
or our family members may have gone through multiple hospital visits, and you know how the hospitals are around right now. Okay, so
Yes.
there is a lot of panic there. There can be grief and sorrow of losing someone as well. So there is a major impact on our mind which is happening. Okay, and if you see
Yeah.
in the second wave, even the government has opened up about mental health, and they want to they issued like a lot of mental health lines, where people can approach and get help when they are not feeling fine with their mind. Okay, so that's why the mental health should be the topmost thing which if we have to discuss something at all. Now, when it comes to mental health, we should use science also to kind of help someone. Now, anyone who's having mental issues right now should be getting the right dose of happy hormones. So when I say dose, in which stands for dopamine. Dopamine is actually a
Okay.
goal-oriented hormone, and what you do is basically you decide small tasks for yourself or small goals for yourself, work towards achieving them. So within the house, it can be making something, some dishes, or it can be through some exercise or anything like that. Once you
Yeah.
achieve it and you feel self-rewarded, this is what brings happiness inside you. So that's how you tackle or kind of influence the dopamine in yourself. Now, then in the dose, D stands for dopamine and O stands for oxytocin, which is basically a love hormone. I think we are devoid of love right now. We can't touch anyone, we can't hug anyone, we can't go out
So
and
true.
do social activities.
Yeah.
So
Yeah.
that is a major thing which we are lacking right now. Yes, we are inside the family. We are giving enough time to the family. That aspect is there, but still
Yeah.
sometimes you need family, you need society and other stuff. So I would say, always be ready to give help to others when they are mentally weak. Or if you want a support, then be ready to always call your friends out and talk to them, and all those things should happen. Be more open towards it. Don't be very introvert and reserved in your house or in your room if you're facing an infection or after your infection. So those things are important to kind of release more oxytocin in your brain. Third thing is basically called a hormone called serotonin. Now, the serotonin is a very interesting hormone. Whatever you eat, your gut produces the serotonin hormone, but majority of it is
Yeah.
being utilized in your brain. Okay. Now, when people are low with serotonin, what happens is they don't feel that they are having healthy sleep. It affects your appetite, it affects your sleep, and with all these things happening, we need to eat right. I think we all have become quite foodie here, whatever we like, we want to just taste it, and all those things are happening right now. Okay, but being very careful about and maybe a right combination of a protein-rich diet and with some carbohydrates is actually good enough to kind of produce more serotonin in your gut. Okay, and that helps
Okay.
because that's gonna give you a good sleep. And okay, I was reading somewhere that serotonin is also connected to the negativity which we have in the brain. it gives you more positive mood. Okay, so that's an
Okay.
interesting thing which we were
Yeah.
seeing in that particular one. Last but most important is your endorphins, which is actually related to today's topic as well. So basically,
Yes.
any vigorous exercise which you do produces your endorphins. Okay, why? And because obviously it gives us happiness, but moreover, what it is actually a natural painkiller as well. So if you're facing a lot of fatigue and pains after COVID, this is something which we need to be doing. And obviously, going by today's topic, you have to pick up exercises. Otherwise, it's very
Yeah.
difficult. Okay. Now, only thing is, how do you regulate the exercise well? That is the only thing which we have to work
Yeah.
towards. Next bigger concern we have is actually physical inactivity. And I would say physical inactivity is like a silent killer. And it's almost been like 1.5 years, we are not being much active enough. Okay. When the lockdowns
True.
are over, we want to just be busy with our livelihoods and other stuffs. That's what we did. By the time we are about to recover, we are again facing lockdowns again. Okay. So we are confined to our houses and rooms, and people who have gone through COVID were like restricted to their rooms also, like totally into some square feet of area only. So there is
Yes.
a dramatic decrease in physical inactivity. Now, what this is bringing us obesity, diabetes, and high cholesterol levels. These three are a good ingredient to cause you cardiovascular diseases. Okay. And especially in women, what happens is it promotes metabolic syndrome. Okay, so basically you will have increased body weight, you will have jumble up of hormones and other stuff will be happening. This can also lead to PCOD or PCOS. Okay, we are not realizing right now, but in later years we'll know what we have lost in the last 1.5 years. Okay, so to promote physical activity is very, very important. I would say, in fact, if I have to bring you some data in last 1.5 years, people who were quite physically active throughout their life, they were less
Yeah.
likely to get a severe COVID infection. So if you're not much physically active, there is a high chance that after the infection, you'll end up going to a hospital itself. And the chances of being, dying is much more. Okay. So promoting physical activity, whether you're indoor or outdoor, becomes very crucial. And we don't know
Yeah.
till what time this coronavirus will live with us, and we have to be confined to our homes for a longer times. So I think this is
Yeah.
something which we have to really fight with. Okay. The third important thing is this COVID-19 disease is directly affecting our lungs. There are many people after the recovery as well, they find that oxygen levels are not normal. So at least they're not able to reach
Yes.
99 sometimes. Okay, because some tissue damage which is done to the lungs is done. Now we need to understand what these lungs do to us. Okay, so what's happening is imagine they are like tiny bunch of balloons all over the places. There are a lot of balloons which are tiny. They expand to kind of receive air into them. The more they expand, the more air reaches to them, and more air means more oxygen is going to reach to your body. Okay, so this expansion is lost in some cases. Let's say people may have 30% damage in their lungs or 50% damage in their lungs. I would say pick up breathing as your topmost priority for your exercises. Okay. Last year I did a video on breath train against COVID-19, and the idea was, can people pick up breathing from the start itself? Because that time we just knew that the lungs are the primary source of
Yes.
area which is getting affected. Okay. So, but what I'm just saying is when you're picking up breathing exercise, and there are so many videos out there in the second wave, a lot of breathing exercises people are recommending. So pick up
Yes.
the ones which are easy for you. And second thing is if you combine a gentle cardiovascular exercise along with it, because that's the one which is going to make the oxygen flow into your body. Okay. So that's how a right combination will help and kind of at least minimize whatever damage the COVID has done to your lungs. The next point is
Sorry. So
basically,
when sorry. So when we'll be talking about the simple exercises which are suitable for someone who's just recovered from COVID, will you be telling us or how within the confines of the house we can do cardiovascular?
yes. So once we are
You'll be
over with
giving
the
us tips.
problems, we'll talk. Yes,
Yeah.
definitely we'll talk
Perfect.
about what all things people can do as well. So people hang on.
Yeah.
There's a lot more coming out once we are just getting over with the theory part
Yeah.
of it. Okay. Anyway, so
Yes.
muscle
Yes.
and joint pains, as we were talking about, people get a lot of fatigue and muscle and joint pains are happening. See, when we are not moving enough, the muscles are weak, and the joints become stiff. Now, in longer run, this
Yes.
is something which we actually see day in and day out. When people get knee issues, And as I said, the arthritis which used to happen around 50, 55 years of age is now we are seeing around
Yeah.
30, 35 years of age. So those mechanical diseases are affecting young population as well. And with this COVID-19 is physical inactivity and not moving enough. And obviously the infection itself is also damaging the muscles. So all these things are collectively not fine for
Okay.
us. Now, people who are facing muscle and joint pain, I would request, can you have short, easy exercises in and trying to do multiple times during the day. So pick up easy exercises which are very easily doable and do it multiple times throughout the day. So that you're able to cope up with your joint mobility, your muscle strength, and maybe a little bit of physical activity it helps. So that ways we can actually cope up with this.
Okay.
Now, fifth is basically the COVID-19 is a biggest enemy to our immunity. Okay, so with people with weak immunity, definitely have more infections or more severity of this disease. Now, there is other aspect as well. As you see young people getting affected with COVID-19 disease, people are actually left with low immune power after the recovery as well. Now, there is a lot of data which shows, when you're physically active and you do exercises, it actually positively influence your immune system. So far, we used to think that, if you drink some kadha or, you have some good healthy food, that's good enough for your immunity. But that's totally wrong. It has to be a collective effort from your exercises, your activities, and what you eat, and obviously how you sleep as well. So all these things needs to be rightly combined to have a better immune system. Okay, so we are doing nothing. We are just advocating why you should exercise, basically.
Yeah, and it's all about mind-body balance.
Yes, yes. Okay, so the next point which comes is basically your low oxygen levels. So you see many people who are having low oxygen levels even after they have recovered from the COVID-19 disease. Now, the thing is, we know that lung is responsible for absorbing the oxygen in the body. Heart is responsible for transporting the oxygen into the body. But when you have weak muscles or inactive muscles, these muscles do have a very important role in transporting basically the oxygen to various parts of your body as well. So it's a biggest transport, your muscles, obviously along with the heart and other stuff. So picking up exercise will definitely benefit if you're facing low oxygen level. The only thing is, I would say, if you remember, there was 6-minute test coming through social media a lot.
Yes.
So what you just need is like a 50 feet distance. You actually cover that distance many times within 6 minutes and see what is your best perfect time to finish that level. Now, doing that, if your oxygen level is maintained, that means you're in good shape. If your oxygen level declines, then you have to be really, really careful how to pick up exercise, what exercise to pick up and all. Okay, because you're not still fine enough to kind of carry on with your healthy lifestyle back again. Last but not the least is, and maybe very important right now, is your vaccination. Okay. Now, when I was reading stuff, I found that there is a data which shows even in older people who have low immunity and other disease and other stuff, if they have been physically active throughout their life, they actually develop better immunity or better antibodies against vaccines, the vaccines which we are taking right now. Okay. There was another data which was very interesting. They say, maybe 2 hours before or maybe 2 days before, if you do an acute intense exercise workout and then you get a jab, you actually get better antibodies and maybe 50% higher than the others. So that was very interesting to me. Yes.
That's very interesting.
And there was a recommendation which was given by a highly credible scientist there, which says, when you're about to get your vaccination, 2 days prior, start your exercise program. Till the time you get your next dose, you should be physically active and doing exercises, which makes your vaccine 50% effective versus others. So I would say people just get very serious about exercising, physical activities. If you find exercise to be boring, maybe pick up an activity which you like so that you're able to carry on with it, because what exercise will be effective is not an issue. Issue is, can you be consistent with it? Because that's the one which makes the difference. Yeah.
Okay.
So these are the problems
that's very interesting.
And the possible solutions which we wanted to discuss about it. Now, I would also like to talk about, how do we reapproach exercises once you have got a COVID infection and now you have recovered from it. Now, very important, because your immunity is low, you're weak, and maybe you have low oxygen levels. So we have to be very careful when we reapproach exercise. Now, almost start with breathing exercises. because that's the
Okay.
thing which we have always and always missed. So I think very less people who pick up breathing as a regular fitness exercise for them. Otherwise, nobody cares for it, right? Because it anyways comes to us. We do it
Naturally.
every second.
Yeah.
So why to do all about it? So start with breathing exercises. Very important for you to restart your fitness journey. Now, if you are actually affected from moderate to severity, like moderate to severe affection was there out of this infection, then maybe when you have to start with your cardio, your yoga, your flexibility programs, or maybe even walking up to 30 minutes only for 2 weeks at least. So basically, you hold on, have patience, don't do high intensity stuff. Obviously,
Okay.
this is recommended for people who have been physically inactive also earlier. So if you are starting your fitness journey now,
Yeah.
start always with your yoga, flexibility, walking, cardio exercises, gentle cardio exercises. Don't straight away go to your weight training or maybe a high intensity stuff. So that's
Okay.
very important. Okay. And my suggestion is, there are a lot of nowadays those group exercises which happens online. If that
Yes.
gets your interest, maybe definitely join them, because then you're bound to do something. Okay. So the next suggestion is basically, if you are a highly active person who used to do weights and other stuff earlier, and you have recently recovered from COVID, then you should pick up body weight exercises first for 2 weeks. Don't go for your weight training in the beginning. We have to be really careful with this decision. And when you switch to your body weight exercises, or sorry, when you switch to weightlifting exercises, cut down your
Yeah.
weight by 30 to 50%. Do
How
not
much?
think
30 to
I want to
50%.
30 to 50% at least.
Okay. Okay.
And do not consider that I want to start from where I left. Let's say I left with 10 kg biceps building. I
Yeah.
cannot be straight away reaching 10 kgs biceps building. Okay, so at least hold on for 15 days, in my opinion, before you actually get on to with your fitness journey. Okay.
Okay.
Now the last but not the least is, any activity you do, whether from mild to high intensity stuff, don't go breathless. Very important. Okay.
Okay.
So I
Okay.
don't want that you guys should be reaching your maximum heart rate in the beginning. You have to gradually build it up. Okay. So take almost like 15 days to 3 weeks to get it back again. So baby steps are very important in this case. Okay.
So is it so as soon as one has recovered, so are we suggesting that within, let's say, the 14-day time period is over, everything is fine. Now you slowly start building on. So start off with breathing for a couple of days, then you pick up body weight training, and then you do weights. And in all this, could you give us a couple of examples? Because I know breathing, everybody knows the pranayam, because that's something which has been widely circulated and almost everybody kind of knows what all pranayam they can do. But in terms of body weight exercises, could you just give a couple of examples? It is just squats, push-ups, and any age group can do. Is there some age criteria as well on body weight? How much? Like, it'll be great to know that, okay, 10 minutes of just exercise for the first week, then you add 5 minutes, and then you add 10 minutes, and then you slowly reach your optimum level. So is there some guidance on that which you can give? I know it's very difficult to do in such a short period of time that we have right now on live, but I think that will really help people in making their own plans, as well as if they want to get back to you for let's say a one-on-one concert, then they know the kind of work they have been doing, and then it will be better for them.
Yeah. So basically, since we are right now visible to masses and we don't know
Yes.
anyone's fitness level as of now.
Yes,
So
exactly. Yeah.
So me considering the worst case possible, where I need people to have gentle exercises in the beginning. So what I'll do is,
Yes.
let me demonstrate a sample exercise program, which
Okay.
should be feasible for anyone and everyone there and of any age. Okay. So a collection of few exercises which can help. Okay.
That will be great.
If you
Yes.
find my voice to be low, please bother me. Okay. Because I'll be a little away from the camera right now.
All right. Yes.
So first important thing is, as I said, almost always start with the breathing exercises, which is very simple. One simple thing is, you sit with a tall posture as if someone is pulling you up like this, and the
Yes.
shoulders are pretty dropped. Have your hands on your ribs, and just think about, you want to expand your ribs maximum. Hands are there because I want to feel your ribs, that they expand when the lungs expand. Okay, so if you see my fingers as if they behave like ribs, and that's how I breathe out. So when I'm breathing in, I'm trying to use my nose. When I breathe out, I'm trying to use my mouth. Okay. Secondly, what I do is, if I, on an average, I take 2 to 3 seconds to breathe in, I hold for another 2 to 3 counts the air into my chest, and I take almost double the time to breathe out. That's what you need with the deep breathing exercise. Okay, and
Okay.
just repeat. So your breathing out should always be a prolonged exhale. So that's very important when it comes to this. Second is basically how do you build up the memory of your diaphragm, which is very inactive in most cases. Okay, and this works for back pain as well. So people with back pain also should pick up this. So you sit up
Okay,
on the
what
edge
I'm
of the
hearing
chair.
is a lot of people who have recovered are having very bad backaches because I guess
Exactly.
extensive lying down, no activity, your back takes a toll.
No, definitely that is happening. And the only thing which we have to say then is, please hold on, have patience. It will take a little
Yes.
time, but you will get there.
Yes.
So that patience is important because there is no quick fix coming when people are recovering from COVID. So it's a slow progress which we are seeing right now. Okay. So anyway, so
Yes.
how do you build up the memory for your diaphragm muscle, which is the most important muscle for your breathing? You basically sit on the edge of the chair and try to lean back like that. Okay, in a slouch manner. Then have your hands on the upper belly, almost where your ribs are finishing. And whenever you breathe in, think that you want to push the belly out. So your hands will memorize your diaphragm. That's how the diaphragm has to move every time you have
Ah.
to breathe. So that's the memory building phase of your diaphragm, which has to be done. Okay. Now, after the memory building, we need to make the diaphragm stronger as well. So I'm going to lie down there on my tummy, and
Okay.
you may have very well heard the term called proning.
Proning.
So
Yes.
here the idea is not to increase your oxygen levels when it's falling low and all that. Here we are just teaching how you can use the bed surface to give more resistance to your diaphragm. Okay.
Okay.
So I'll just demonstrate what it means. So I'm just lying down here with my hands under my forehead. And
Okay.
whenever I breathe, I push my belly down into the bed. Now the bed becomes almost like a resistance to my diaphragm whenever I try to
Yes.
expand in my upper belly. So that becomes a resistance training to the diaphragm. Okay.
Yes.
So not taking much time with the breathing exercise. This is a simple device which used to be given to cardiac patients and lung patients in the hospitals. But
Yes.
this is very important for people who are fitness enthusiasts, runners, and recovering from COVID. So this has become a very important device for them. And what you can do is, interesting is you can train your inhalation and exhalation both through this device. And obviously what you have is you can see different colors of the balls. So it means, that whenever you push each ball, it's actually pushable, taking different volumes of air into your lungs. So basically it's like 600 cubic meters, then 900 and
Yeah.
1200. So when I'm doing this, I have to blow the air into the mouthpiece, and mouthpiece needs to be very, very clean and only for you, not for any
Yes.
family member. Yeah. So let me just do that again. So I'm going to blow the air when this is reversed.
Yes.
Now don't worry about how many balls you're able to lift up. Whatever is comfortable is important.
Okay.
Second thing important is the ball should be up in the air at least for 2 to 3 counts, so that
Okay.
you're getting enough resistance when you're doing that. So when I'm keeping the device upside down, I'm able to exhale and the ball is moving. Similarly, if I keep the device upright, I'm going to inhale. You see that? So that's how
Yes.
this resistance training can be done by respirometers. Now, people are in lockdown, and I understand there are a lot of people who can't go out. So either you buy it from Amazon, and if nothing else, this simple balloon can work. Okay? What you just do is take a deep breath in first, and like that. Okay? So I'm not saying that you should kind of make the big balloon, the balloon bigger and bigger. So just
Yeah.
each breath, just push the balloon out and recover well. So these are the simple advices which can be done for the breathing exercises. Now let's talk about a combination of mobility and little body weight strengthening exercises.
Okay.
Again, I'll be a little away, so I'll try that I'm audible enough. We start with spine mobility exercises. We start with cat camel exercise, so where your hands are right shoulder and knees are right and you try to kind of get all the way up. And
so basically on all fours, inhale, round the back, exhale, dip.
Exactly. Now important is that the head and pelvis should move all together. To kind of keep the spine moving fully. So that's very important. Now there is some pain gets done. Second is also very important because the back gets very tight. When you're sitting in front of the computer, working online, you sit on the bed, hold on to your side and try to just sit back and keep the little side of your body. Similarly, on the other side, go here and with that, and this is where you feel the stretch. And it can be like 5 seconds stretch up 7-8 times. Okay. The next exercise is also very simple. You lie down straight on your back, bend one knee, with the opposite hand grab the knee, and this hand, free hand goes all the way up. And just try that and rotate to the other side to mobilize your spine. Now this can be 5 seconds forward, 8 to 10 repetitions can be done.
So basically you're trying to move the spine in all directions.
Yes, that's very crucial because we have been sitting all day. When we are in lockdown, isolation, we have been sitting and sitting is not all good for your spine.
Yes.
So that mobility becomes very big. The next exercise you should pick up is like bridging. Just bend your like that.
The bridge.
Go up. Squeeze your buttock muscles every time you do.
So you inhale, go up, exhale down.
Yeah. Right.
Perfect.
Now this can be again 10 repetitions, 5 seconds forward. That's what we did. The next exercise is also very simple because again targeting the lats muscle. This is something which is really close tight. Next, you get your one hand up, hold the elbow, and try a side switch. And this can be done while being on the computer itself. And this can be 70 times, 5 seconds forward. And obviously on the other side as well, make sure you turn only the upper body and you go all the way like that. So that's how we do the side stretches around here. Okay. Now our thoracic spine, the mid spine is also very important. What we simply do is to pick up the base of the neck by crossing the fingers like this. Maybe get your elbows together and do rounds and rounds like that. And then do anti-clockwise. It's a very thing, but kind of really mobilize your spine from the upper side. And this is very good for people who face shoulder pains, neck pains, and other stuff. Okay, so that's important. Now, as you mentioned about body weight training, a little bit of things which you should be doing is pick up your calf muscles because they are almost like second heart of your body, and they help in circulating the blood very well. So you can simply hold on to a surface and just try to do some movement like that.
So basically up on your toes and back.
Exactly. I can't see my toes right now, but what I'm doing. Just trying to get onto my toes first and slowly come down.
So basically calf raises, going up on your toes and back on the floor.
Exactly.
Okay.
Second is also very simple. No need to worry about what kind of a technique we need for squatting. Simply use your chair. And stand next to it and sit down and get sit down and get back. To make it more intensive, you can go down, almost reach closer to the chair, but don't sit, and then come back. Just makes it more efficient as a squat. Okay?
And I think slowly as the fitness levels come back, you can remove the chair and you can just do an imaginary sitting on the chair and back.
Exactly. Then you can start going like deeper as well.
Yeah.
You start holding as well.
Yeah. I think it's so important to listen to your body and just go step by step for recovery.
You have taken my words. I was about to say that. So very, very crucial basically.
Yeah.
Listen to your body. That's very important. You will never go
Yes.
wrong if you're listening to the body.
True.
Okay.
True.
Now, picking up push-ups is also important. So, if you have like a high table like this here, you just lean onto it and then just kind of going into the push-up and push-up. And that's a very important. Now, people who can't do the push-up comfortably,
Yeah.
they can actually go onto the wall itself and do little
The
high
wall
numbers
push-ups.
because
Yes.
it's an incline one bothers them.
Yeah.
I would
So-
recommend don't go to the ground push-ups in the beginning because these
Okay.
muscles have become tight in whatever isolation periods you have been, or
Yeah.
maybe working from home laptops.
Yes.
So when you're pushing too much from your chest muscles, it just makes you more tighter on.
True.
Okay.
True.
Second thing is when you do a push-up, people normally hold at the upper side, they never hold at the bottom. I would
Yeah.
request people to hold at the bottom because that's the time when the muscle is in a stretch position.
Okay.
Okay. So that's going to help us that imbalance which has happened where the muscles are tight here and weak on the backside. So that way it
So,
will be helpful.
Dr. Kunal, so all the exercises that you've told till now, because a lot of our audience is pregnant moms as well. So except for the one where you were lying down on your belly, other than that, I think all these exercises are suitable for pregnant moms as well, because, at
Exactly.
Disha for Moms, we really work extensively with pregnant women. And, so because a lot of our clients have had COVID and they've recovered, and, some have delivered, some are on way to, going to deliver soon. So I'm just thinking that all these exercises are going to be beneficial for them as well.
Definitely yes, definitely yes.
Except for
The
lying
reason
down on
for
that
picking
tummy,
up these
ladies.
exercises was so that almost all category of people can pick it up
Yes.
and do things.
Yes.
And as you rightly mentioned, they should not lie on their tummy, but
Yes.
otherwise all exercises
Otherwise,
are very,
everything.
very
Yeah.
doable. Yeah.
Perfect.
And
Perfect.
especially these heel raises and squats are very, very important for pregnant women because as you said, this varicose vein is very, very common in
Yes.
people who are undergoing pregnancy. So
Yes.
I think very important and relevant exercise for them.
Great. 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 So these
So
were
over and
really
out
useful. Yeah.
Yeah.
Really useful tips.
Yes. So any questions if someone has, otherwise we'll just wind up.
We will take up the questions. I've asked everyone to keep posting their questions on the chat, and whoever has posted, and if the query has not been answered in our discussion, we'll be getting back to them after consulting with you.
That's wonderful. You can write
Yes.
write
Yes.
them back.
Yes.
if they
Yes.
want, yes.
And this video anyway will be available on your platform, on our platform. So anybody wants, they can always go see it, rerun it, and see what exercises were recommended. So Dr. Kunal, thank you so much for these really, really amazing tips. I'm sure it will be beneficial for all age groups, for all people. And I'm sure we'll be coming back for more sessions with you.
Thank you. Thank you.
Thank
Shruti.
you so much. Thank you.
Everyone. Yeah.
Thank you everyone for joining us today. Thank you.
Sure. See you. Have a good day.
You too.